Good afternoon, everyone. I'm Nirav Shah, the director of the Maine Center for Disease Control and Prevention. I'm here with you today to provide you an update on where we stand with respect to COVID-19 all across the state of Maine for today, Monday, December 21st, 2020. And I begin today's update on yet another sad and somber note. Another Maine person has died with COVID-19. She was a woman in her 80s from Cumberland County, and her passing marks the 293rd death associated with COVID-19 in Maine. I'd like to take a moment to offer our deepest condolences to her family, friends, and community during this time of grief. Overall, across the state, there are 19,285 cases of COVID-19 statewide. Of those, 16,721 are confirmed and 2,564 are probable cases. Overall, 980 people have been hospitalized with COVID-19, and in the past 30 days alone, 309 people have been hospitalized. Right now in the state, 170 people are currently in the hospital. Of those 170, 44 are in the intensive care unit and 18 are on ventilators. As I mentioned a moment ago, sadly, 293 people have died with COVID-19, and among our cases, 2,263 are among healthcare workers. I'd like to take a second now to turn and provide an update on some of the outbreaks that Maine CDC has opened just in the past 24 hours. And of those, the ones that I'll be reporting on from now and going forward are outbreaks that we believe have a higher degree of public significance. There are a number of outbreaks that open and close every day. Indeed, on some days, it's almost too numerous to count, let alone report on. So going forward, we'll just try to be providing a snapshot of those outbreaks that we believe have some degree of public significance, or rather public health significance associated with them. And just in the past 24 hours, Maine CDC has opened an outbreak investigation at Caribou Rehab, where we are aware of 5 cases, as well as at Deering High School, where we are also aware of 5 cases, and at Portland High School, where we are aware of 3 cases. I'd also like to provide an update on the outbreak situation that we started working on late last week at Eastern Maine Medical Center. Right now, that outbreak accounts for 48 cases of COVID-19, 40 of which are among staff members and 8 of which are among patients at EMMC. Our team has had a number of productive phone calls with the entire team at EMMC, and we know that this is one of their top priorities right now. We have been working with them on everything from infection control to epidemiology to additional lab testing as needed to make sure that they have everything they need in order to get control of the situation. We will continue to work with them and similarly continue to provide updates as we learn more as the investigation proceeds. I want to stress, this is an epidemiological investigation. Our focus here is on understanding and getting the COVID-19 situation under control. And again, we will continue to work with our colleagues at Eastern Maine Medical Center as we learn more and as further testing gets underway. Turning next, speaking of testing, to an update on where we stand with testing across the state. Right now in Maine, the 7-day PCR positivity rate stands at 4.35% for PCR tests. And the PCR testing volume in Maine stands at 526 PCR tests for every 100,000 people. Turning now to antigen testing. Our 7-day antigen testing positivity rate stands at 4.86%. And our antigen testing volume all across the state remains largely where it was yesterday, which is at 152 antigen tests per every 100,000 people. And finally, let's turn to vaccines. Cumulatively, right now across the state, there are at least 4,682 individuals who have been vaccinated with their first dose of the COVID-19 vaccine. That number is a little bit low because, as we've seen, vaccine administration events are ongoing as we speak right now. In addition, we are aware of one institution that has had a little bit of a challenge getting their data uploaded and chatting with Maine CDC system. So that number of 4,682 is undoubtedly an underestimate of the true number of individuals who have already received their first dose. We're working with that institution to make sure that their data reporting system is squaring with our system. But for now, that is the total number that we can confirm who has received their first vaccine dose of the COVID-19 vaccine. Again, that is undoubtedly an underestimate, but I can only claim what I can confirm at this point. The other big news is that the first shipments of the newly authorized vaccine made by Moderna have arrived in Maine. Overall, this week, the state of Maine anticipates receiving 24,200 doses of this Moderna vaccine for use in healthcare settings and by first responders all across the state. Just today, we've started receiving the first such shipments, and we believe, based on what we've been briefed by Operation Warp Speed, that the remaining shipments should be arriving at healthcare facilities start by tomorrow. Additional shipments came in this morning, and again, the balance of those should be arriving tomorrow. In addition to that, our partners in the long-term care community have shared with Maine CDC the good news that the first individuals under the Retail Pharmacy Partnership received their COVID-19 vaccines earlier today. Again, this is a partnership that has been engineered and launched by the US CDC, certain commercial chain pharmacies like CVS and Walgreens, working in partnership with long-term care facilities across the state. That partnership entails the state of Maine committing certain numbers of doses and then working with pharmacies and long-term care facilities to get vaccinators into those facilities to vaccinate both the residents and staff against COVID-19. I'm pleased to report that, again, according to our partners on the ground, the very first individuals in Maine have received their COVID-19 vaccines under the auspices of this program. We are know that there is a long road ahead of us with respect to that program, and we've been communicating with both CVS and Walgreens to make sure that they've got everything they need, vaccines, supplies, and personnel, to make this program live up to its true potential. Before I turn things over to questions this afternoon, I wanted to pick up on a couple of questions that have come into us regarding COVID-19 vaccination. Friday, I spent a long time talking about the vaccine and how it was rushed. Today, I'm going to take a different tack and do just a few really quick hits on some key questions that have come into us just in the last 48 hours with respect to the science and the safety underlying the COVID-19 vaccine. Let's start with one that is probably the most common since Friday, and that is around reports of some adverse reactions that have happened in the past couple of days during the first week of administration. As of Saturday, across the United States, there were 6 serious reactions among individuals who had just received the COVID-19 vaccine. This includes individuals who had, say, pre-existing anaphylaxis, a pre-existing type of allergy or sensitivity to the vaccine, and in whom the administration of the vaccine triggered things like difficulty breathing or hives or other serious concerns. All 6 of those concerns were immediately recognized. They were all immediately treated. No individuals were hospitalized, and all 6 of those were quickly and appropriately reported to the US CDC, which is how I was briefed on them. It's also important to keep in mind that as of this morning, there have been roughly 550,000 first doses that have already been administered across the United States. Of those 550,000 or so doses, what we've seen thus far is 6 of these serious reactions. All that being said, we know from the clinical trials of both the Pfizer and the Moderna vaccine that non-serious reactions can and will happen. This includes having some soreness in your arm after you get the shot. It may also include things like a fever or fatigue. Those are to be distinguished between the serious reactions that I'm referring to, which involve serious rapid allergic reactions to the vaccine. The non-serious reactions, which were well described and studied in the clinical trials, will occur in even higher percentages. And again, these include things like pain in your arm, a slight fever, and maybe some fatigue, perhaps after the first dose, but more likely after the second dose of the vaccine. Another question that's come into us is, do I still need to wear a mask after I get my COVID-19 vaccine? And the answer, based on what we know today, is yes. And that's because although there are some early and encouraging data to suggest that the vaccine will limit your likelihood of transmitting or harboring the virus, more research is needed. And that's why if you are among now the 5,000 or so people in Maine who have received your first dose of vaccine and the subsequent set of folks who will soon be receiving later doses and their second doses, we still recommend that you wear a mask and you engage in physical distancing. Because until all the data are known on whether the vaccine reduces your likelihood of harboring or spreading the virus, we still want to take all the steps to stay safe. Another question we've gotten is, what about the second dose of the vaccine? Where is that coming from? And does your plan account for those? And the answer is yes. Our planning and the numbers that we receive and report on anticipate and assume that there will be a second dose. Indeed, those second doses are being manufactured and are being held in reserve for states. They will be delivered in partnership, in conjunction with the respective first doses at the appropriate time to match the administration of the first doses. So those second doses have been accounted for, they will be accounted for, and they will be delivered when the time is right for those individuals to get their second dose. And finally, if I've had COVID, do I need to get a vaccine? Well, the answer there is yes. If you are among the close to 20,000 people in Maine who has already gotten COVID, and sadly increasing numbers who will likely get COVID in the future, getting the vaccine is still a good idea. Although your body will have some degree of natural immunity to COVID-19 after getting it, based on some of the early data that we've seen, the immunity level that you get from the vaccine may be higher, may be more robust than what your body's own immune system is able to generate. That is to say, the vaccine may confer yet an additional layer of protection against COVID-19, such that even if you've had the disease and have recovered, getting the vaccine is still a good idea for you. So with that, we're going to turn things over to our colleagues in the media for the afternoon. And the first question today goes to Allison Ross.
Hi, Dr. Shah. Always exciting to be first. So I have just a few questions about the vaccine. So we've kind of heard during this pandemic that the virus mutates rather quickly, and we have been following this new variant that they say is popping up in the UK. So for those in group 4 of this vaccination, should they be concerned? Will this vaccine even really still be effective for them? And are you concerned at the Maine CDC about this new variant?
Thanks for that question, Allison. Let's talk about these reports of a new strain. Let's talk about what we know right now and what we don't know and what the bottom line is. Let's start by talking about what we know about these new strains. And the first really important thing for everyone to keep in mind is that this is what viruses do. They change as they reproduce. And as they reproduce, there are new insertions or deletions into their genetic code that result in changes to the way that the viruses behave. And this is what viruses have always done throughout recorded history. The virus is going to do what the virus is going to do. Now, this new strain appears to have very quickly attained predominant status across Southeast England, starting as recently as late September. And it appears to have accounted for an outsized fraction of the new cases that have been diagnosed starting in Southeast England and now across England. That is likely because the virus appears to be up to 70% more transmissible than the prior virus that was circulating in England. Now, as of right now, the new strain does not appear to be associated with increased morbidity or mortality, increased hospitalizations or severe illness. And given that it has been circulating since late September, one might have expected to see such changes in the virulence, the intensity of the infection that it causes if it were going to happen, but we can't rule that out at this time. Here's what we don't know. Right now, we don't know whether the new strain is driving the massive increase in new daily cases in the UK, or whether that spike is a function of, say, human behavior. The other thing we don't know at this time for certain is whether this new strain will undermine the efficacy of the vaccine. But based on everything that we know right now, it does not appear to undermine or alter the efficacy of the vaccine. And I say that having had the privilege and honor of actually asking this exact question at a public advisory committee meeting that the US CDC held this past Saturday. And I was able to pose this exact question to one of the chief scientists at Moderna. And this individual responded that Moderna has, for quite a while now, been testing the efficacy of their vaccine with some of the strains that have popped up across the globe. And what they briefed out was that they've designed these vaccines to take into account the possibility that viruses are going to do what viruses are going to do, which is change. And what they effectively said was it takes more than just one little strain to undermine the vaccine's efficacy, but we can't rule that out in the long term. And so there's the possibility, Allison, that sort of like the flu shot, the COVID-19 vaccine may have to be upgraded or improved upon if the virus changes sufficiently. At this time right now, we can't predict that. The bottom line with this new strain is that it's concerning, but not unexpected, given that this is what viruses do. It definitely merits further scrutiny and continued biological surveillance of samples that come in.
So, Dr. Shah, just hypothetically speaking, if this new strain did impact the efficacy of this vaccine, would we then start again at group 1 if we were in group 3, or would we continue to vaccinate, if that makes sense?
It does make sense, Allison, and I can't speculate on what might happen if other things happen. Based on what we know right now, the efficacy of the vaccine does not appear to be undermined by this new strain in the UK, or for that matter, another strain that was just described in South Africa. If that were to change, we will make course corrections and adjustments, but it's way too premature to even countenance what those might be, given that based on what we know right now and what the vaccine scientists have reported, the efficacy right now doesn't appear to be undermined, but it's too early to predict, and thus I can't speculate.
Great, thank you.
Mm-hmm. I am going to turn now to Steve Missler.
Thanks, Dr. Shah. I think it was last week you had mentioned that every nursing home in that top tier would have its first dose by the end of January. I mean, if I have that wrong, correct me. But if that's true, is everything still on track given the reductions that we've seen in the supply?
So first, Steve, a gentle correction. What we have been told by the pharmacies, and again, I want to emphasize, Maine CDC is not operating this program or this partnership. It is being run in conjunction with the US CDC and the pharmacy chains themselves. We are an engaged participant and onlooker, but the execution of the program is in the hands of others. What the pharmacies have told us was that all long-term care facilities in Part A, which are skilled nursing facilities, all skilled nursing facilities in Maine should receive at least their first of 3 vaccine administration events by the end of the first full week of January, which is January 8th or January 9th. We've received some reports just today of vaccine clinics being moved or rescheduled. We investigated one actually and found that it was due to some miscommunication, and we were able to work with the retail pharmacies and Operation Warp Speed to hopefully get it rescheduled and back on the books. I've got concerns over those timelines. Rest assured that we are going to be inquiring and have been inquiring and setting up regular meetings with the retail pharmacies to make sure they are on track. And if they are getting off track, we want to do what we can to help them get back on.
Got it. Thank you for that. And another question related to the pharmacy program is I think CVS has indicated that it needs, CVS in Maine, the franchises in Maine need to hire something like 40 more people. We haven't received anything definitive from Walgreens as of yet, but are you concerned, and what role can the Maine CDC play that the pharmacies may not be ready for this rollout? Is that something that you guys are worried about, I guess?
I will say, Steve, it's a concern. It's one that we have investigated. It's one that we have set up regular meetings with, particularly on the staffing piece. But in addition to staffing, questions around making sure they've got the right degree of PPE, questions around making sure that those who are going in the facilities have been tested and have tested negative, so on and so forth. So we've made sure we've asked those hard questions, and where we've gotten answers that didn't cut it for me, ask harder and make sure we were digging deeper. Staffing, of course, is a question that we've raised. We've been told that, for example, CVS, as you noted, has hired additional pharmacists and pharmacy technicians to go into the facilities to conduct these clinics. I know that Walgreens has done so as well. I think I see our role here as being involved and almost one of making sure we are asking hard questions so that we can make sure the program launches and is executed on the timeline that has been presented to us.
And just real quick on the same topic, there was one of the nursing home providers that we have spoken to said that they had heard that they may have to wait until January to begin administering their first doses. I'm not sure if it's related to that. I can't give a name of a nursing home on the spot. I apologize. But is that what you were talking about just a moment ago, where you had heard that they were delaying and you were worried that delay was unnecessary?
That's right. That applies to at least one facility. Perhaps it's the same facility. I won't mention the name either, but we did receive a report that one facility was rescheduled for a later date. The reason particularly why we jumped onto that one is because they had been scheduled to go this week, and it was then pushed to early January. And the reason that we were given didn't quite square. And so that's why I asked our head of immunizations to make calls, and we learned that what was happening did not square. And we understand that Operation Warp Speed, the US CDC, and the retail pharmacy are, having had their information corrected, are working to get that facility back on the schedule. Now, the pharmacies themselves have represented to us that there may not be facilities who are scheduled for their first clinic into that first full week in January. So that is an expectation that they've set for us. I had hoped for it to be sooner, but I also recognize that there are a number of facilities in Maine, and in talking with my counterparts across the 50 states and territories, they have been told the same by Walgreens and CVS, which is to say, for vaccination events to start with their first ones between this week and the 2 subsequent weeks. So what Maine has been told is at least consistent with what other state health directors have been told as well.
Thank you.
Mm-hmm. I'm going to turn now to Amy Brown at WERU.
Thank you, Dr. Shah. Just quick before my questions, to follow up on something you said earlier about there having been no hospitalizations following the vaccines. The New York Times reported that one of the women who had an allergic reaction in Alaska was kept overnight for observation. Does that not count as being admitted, or?
What I was briefed on by a senior official at the US CDC is that there were no hospitalizations.
Okay. We've had a lot of questions about how Tier 1C is going to work. And do you know if there's going to be some kind of scoring system, X number of points for age versus different conditions, or will it be decided on a case-by-case basis by people's primary care providers, or how will that work?
Well, phase 1C, which is many months away still, it's not starting this week, next week, or the week after. It is several months away. Will be a phase where older Mainers, as well as all Mainers from age 16 to 64 who have high-risk medical conditions, will be offered vaccine, as well as other individuals who are critical to societal functioning. Now, how they are notified of their place in line is going to depend on which of those categories they fall into. But as you noted, Amy, it will probably be in part a situation where healthcare providers are letting their patients, their clients know that their time has come and it's time to schedule a vaccine.
Okay. And looking at the CDC website, recoveries appear to be slowing. Is that actually the case, or is it more that there's a delay in posting that since case investigators are so busy now?
Well, it's a function of who we are investigating for cases, and more a function of the fact that we are making one phone call right now to individuals and not having that second phone call to close that out. This is something we've talked about on different occasions. So it's almost entirely a function of that.
Okay, thank you.
I'm going to turn now to Kevin Miller at the Press Herald.
Great, thank you, Dr. Shah. So one question for you. I guess today or over the weekend, the Federal Advisory Committee on Immunization Practices voted to recommend adults 75 and older, as well as some essential workers, such as, I guess, grocery store workers and teachers, be moved into Phase 1B. As I understand it, and please correct me if I'm wrong, that's basically just a recommendation that will be considered by the U.S. CDC, and they could come out with their own thoughts. But based on kind of where we're at with our current plan, it looks like most of those folks would be in Phase 2, right? Or our current plan. Yeah,
sorry, I'll let you finish, Kevin. Yep.
Yeah. So my question is, if that recommendation, or I guess I assume that you've seen that recommendation, do you have any thoughts on it, and could it lead to changes to the timing and the rollout of our own phases here in Maine?
Yeah. So, all right, Kevin, I'm not sure where to start, but let me just give it to you really straight and directly. The plan that is on our website that most states constructed way back when in October, it seems like an eon ago, that plan was constructed based on the framework that the National Academy of Science had put forth. Since that time, the US CDC's advisory committee, which you referenced, which met this weekend, has taken a deeper look and put more public health oomph into their analysis. And so the bottom line is that the plan that is on our website does not accurately reflect the latest thinking from the US CDC. But that's only because, just to be totally candid, we haven't had a chance to update it yet because we've been focused on getting vaccine out the door to hospital workers and long-term care facilities. The plan that my team and I are thinking about, the plan that we are focused on, the strategic approach that we think resonates and is our guiding principle is that which the US CDC has been working on for the past 5 or 6 weeks, informed in part by, in fact, informed almost entirely by the recommendations of this advisory committee. So Kevin, what I'm trying to say is this change is not a change for us because it was one that we have anticipated. And just to be completely straight, we haven't updated our documents in a way that we probably should have to reflect where our current thinking is. But I want everyone to know that we've been tracking with the US CDC, for example, in Phase 1A, with respect to frontline healthcare workers, long-term care facility residents, that is entirely consistent with the US CDC's plan. The same will apply for 1B, perhaps with some modifications, as well as with 1C. So does that make sense, Kevin? I don't want to overstate it, but this wasn't a change for us because it's been what we've been operating under for a while. We just haven't updated the plan on the website. We need to do that, but candidly, we've got, been working on some other big things too.
No, I understand entirely, and I appreciate the clarification. That's, I think all of us are trying to keep up with this, so I appreciate you guys giving us updates.
I didn't want you to perceive the US CDC as in conflict with our theories or our guiding principles. It is not, even though the plan that is on our website is admittedly stale at this point, the new US CDC guidance, and I participated in those meetings. I'm a liaison representative on behalf of other state health directors. So I've been an active participant in those meetings. That's where I asked the question about the Moderna vaccine to Allison's earlier point. So I just don't want you to think that this was a conflict with our operating principles in any way.
No, great. I appreciate it. You guys got a lot going on. You don't understanding not being able to update paperwork online all the time. So the other...
It is on our to-do list, but we just haven't gotten to do it yet.
No, understandable. Do you have an update on the York County outbreak that you mentioned? I think it was on Friday. York County, yes. The hospital.
Yes,
outbreak
I
that you mentioned on Friday.
As of right now, in recent days, there have been 8 additional staff members who have tested positive at York County Hospital, bringing their total to 44 positive staff. One cautionary note, though, Kevin, some number of those 44, I don't have the exact number, but some number of those 44 are actually part of the outpatient clinic, not the inpatient service. But in outbreak settings, we include them because we want to cast a broad investigatory net. But the total number is 44, reflecting 8 additional positives.
Great. Thank you so much, Dr. Shah.
Yep. I'm going to turn now to Charlie at the BDN.
Yeah, hi, Dr. Shah. Thank you. My first question is about the state's vaccination plan, the COVID vaccination plan. One of my colleagues has heard from some healthcare workers who work in hospitals or other facilities but are not directly employed by them. And they've said that they can't get clear answers on when or if they are included in the state's vaccination plan. So can you just explain, is employment at a hospital required to get vaccinated in the state's plan?
You know, it's a good question, Charlie, and that concern has been brought to us as well. We have to a certain degree asked hospitals to do what they think is the right call, given the risk that employees or healthcare providers face, whether they are attached to the hospital or directly employed by the hospital, or perhaps just have privileges at the hospital. We've really asked the hospitals to make those determinations. I am aware, for example, of one healthcare system in Maine that has opted to vaccinate individual providers in the category that you mentioned. I think what we need to do is make sure that our recommendations are more uniform. I don't think we've really done that as explicitly as we need to, but that's the state of play. They are certainly not excluded from receiving vaccination. So to the point you made, Charlie, there is no explicit precondition that someone needs to get a pay stub from a hospital in order to avail themselves of vaccine there. If they're a healthcare provider who is encountering patients in that facility, it behooves all of us to keep the healthcare system healthy and have those folks vaccinated.
Okay, so just a quick follow-up then. So the plan itself does not kind of specifically differentiate between, whether it's someone with privileges or someone who just works for an outside agency but is in a hospital. Is that kind of accurate?
That is correct, Charlie. We are in mass vaccination mode right now, and so the divisions, the cuts and the nuances that you made, they're not where we're at. We're the goal is to get everybody in the state vaccinated twice. We're not getting into if you have privileges but you don't get this, or you only admit 10% of patients, and nope, not getting into that. We got to get folks vaccinated.
Okay. And then another question is about the outbreak I guess part of it is about the outbreak at EMMC. I just wondered if you had, if Maine CDC has determined any sort of cause or circumstances that have contributed to that one. And then maybe just relatedly, I'm wondering if patients, do you have any sense how, what Maine Hospital's protocols are for testing patients before they're admitted? Is it something that all hospitals are doing, or just a few hospitals are doing, or maybe I don't know. Do you have any sense of that?
Yep. So as to the former question, Charlie, I don't think our medical officer who is leading that investigation and one of our epidemiologists, working very closely with the epidemiologist and medical team at EMMC, I don't know that they've identified the initial patient or the initial staff member. I don't know that we know whether it was a patient or a staff member who was the fount of the outbreak or the first case. I know that's underway, and they're trying to match up all of the cases to determine who had the first onset of symptoms and whether the work schedules align and that the transmission patterns make sense. As you can imagine, with 40 plus cases, it's quite painstaking. So at this time, I don't think they've identified any sense of how the outbreak started or how it was generated. But more generally, to the question about, say, testing of inpatients, it does vary. It varies based on the nature of the patient's inpatient status. If they are coming in for an elective procedure that will merit hospitalization, that's one thing, and they can be tested well in advance or in the run-up to their admission. If they're coming in on an emergent basis, it's a little bit different. So I think it really does depend. Hospitals have been following, I think, protocols from their respective professional societies, be that the Infectious Disease Society of America or other groups, in terms of how to test patients and when. It really does depend quite greatly, though, on the reasons for which someone is coming in.
Okay, thank you.
I'm going to turn it over to Emily Tadlock next.
Hey, Dr. Shah. So I'm kind of going to go backtrack with you for a second to one of the previous questions that was just asked. So many of our viewers are asking why we aren't reporting those active cases anymore. To them, that is one of the most important numbers in their personal communities. So obviously we've done this because, as you mentioned last week and again today, the Maine CDC can't keep up with recoveries anymore. So can you explain that a little bit for them to understand why we can't report these active cases? And then can you also explain to me why you guys are still reporting those recovery numbers on your website then, if you say you can't really keep up with it?
Sure. Let's start with that latter question. We still track recoveries if the information is known to us. So, for example, if we happen to make a second phone call to somebody, or if someone reports to us that they have met the various criteria, or their healthcare provider reports that to us, we continue to track those numbers, but they aren't as robust as they used to be. Similarly, with respect to active cases. Now, Emily, one important note there, the concept of an active case is not something that carries a lot of epidemiological weight. You will note that in 140 plus briefings, I've never once commented or talked about our active case numbers. And that's because that number is highly variable. It is subject to dozens upon dozens of limitations. And it's not something that, as an epidemiological matter, we really use on a day-to-day basis, let alone as a decision-making tool, because it has so many variations and it has so many contingencies attached to it. One of those contingencies is our ability to update the information on a frequent basis. It also presupposes some things that aren't necessarily epidemiologically true, which is to say that it's a reflection of overall case activity in a particular area. We know that's not the case. The virus is omnipresent across the state. And by focusing on so-called active cases, not a term that I use, but it could lead to the false impression that the virus is existing in pockets. And if you happen not to live in one of those pockets, you are somehow protected in some way. That is not the case at all. The virus is everywhere. But again, as we have changed the way that we do case investigation to more mirror what other states are doing, we don't always have that data at our fingertips. And that's okay, because what everyone should be focused on is not how many active cases there are in their zip code. They should be focused on wearing a mask everywhere they go, engaging in physical distancing, avoiding crowds, and avoiding contact with individuals in crowded settings where the virus could be transmitted.
Thank you. I appreciate that. And then just one follow-up question. We had a viewer that emailed me, and she asked, she is currently pregnant. She's hoping that the vaccine will come to her, but what advice do you have to offer other women who are pregnant who are looking and thinking about getting this vaccine? I know you're probably going to say, talk to your doctor, your personal doctor, but what do you have?
Yep. I was Emily, I wasn't sure how many quick hit questions I was going to do today, having went on, as Patrick referred to it, as on a monologue on Friday. So I didn't want to spend too much time on this, but this was one question that I was going to talk about maybe on Wednesday, but we'll talk about it now. First of all, congratulations to your viewer. That's great news. And it's a happy time. And hopefully the vaccine will be available. Based on the clinical trial data, even though the vaccine was not explicitly studied amongst pregnant women for safety concerns, That's how all vaccine studies are done. There were individual instances of women who became pregnant during the trial, providing researchers an opportunity to study the safety and efficacy of the vaccine in them as well as in their newborns. And thankfully, the data there were reassuring. There do not appear to be any significant safety concerns that are presented by the vaccine, either to the mom or to the baby. But as you noted, Emily, it is a situation where I think ultimately the recommendation is for the moms to talk to their doctors about when the best time to receive the vaccine is. Based on what we know right now, though, pregnancy is not a contraindication to receiving the virus, and that's a good thing.
Thank you.
Mm-hmm. Patrick, over to you. Patrick may be upset with me.
No. I'm sorry. It's just that the unmute button moves around the screen, and it's not my fault. Thank you very much, and happy solstice. I would just like to talk a little bit more about the arrival of the vaccine at long-term care facilities. If you could talk a little bit more about how critical of a piece of the puzzle this is in a state that has one of the highest median ages in the U.S., that would be terrific. And also, are we still likely looking at end Q2, beginning Q3 for sort of the availability to the general public? Because moments ago, you mentioned that I think it was phase 1C is many months away, and that sort of might make some folks a little bit anxious that, the general rollout is many, many, many months away.
Yep. Sure thing, Patrick. Let's first address the long-term care piece, which, as you say, is really critical in our state, in every state, but certainly in Maine. Just to provide a little bit of numbers around that. For example, in the first week's allocation that we received of the Pfizer vaccine last week, so not for this week, but for last week, we allocated of those 12,675 doses, more than half were allocated to long-term care facilities. In this week, it's a little bit less than half. So of this week's Pfizer allocation now of 8,775 doses, about 4,000 are for long-term care facilities, and the other 4,700 or so are for hospital-based providers. So that just gives you a flavor, as you noted, how importantly we're taking this. We are trying to commit as much as we can of the Pfizer vaccine, which is what we are using in the long-term care facilities, for the staff and the residents there. It can't come soon enough, and it can't happen quickly enough. One reason, to Steve's earlier question, we've been really checking in and, dare I say, holding the feet of the retail pharmacies to the fire to make sure that they too are operating with velocity and equity as they are going out and vaccinating in long-term care facilities. Everyone who is watching this today knows the disproportionate burden that individual residents and staff in long-term care facilities have carried with respect to COVID-19. An outsized proportion of deaths that have occurred in those facilities, and a high number of cases, to say nothing of the longer-term morbidity. So one reason we really wanted to focus our efforts when the opportunity came for us to engage in this partnership and activate it, we didn't hesitate. We flipped the switch immediately. So that's kind of where we're at there, Patrick. And we're going to continue to make sure that the rollout happens and it's happening on a timely basis. With respect to the longer term horizon, all of this depends on the supply of the vaccine. And given what we learned last week about the lower than anticipated supply for this week's Pfizer allotment, I think there is reason to be cautious and not overly optimistic or irrationally optimistic with respect to when longer term horizon planning for community vaccines can happen. Now, we've been given projections by the US CDC for the nation, not Maine specific, about what the production ramp for other vaccines looks like. But I think there is good reason to think that even at those production levels and those production ramps, it may be Q3 until we get to later phases which is to say individuals who are not older, individuals who do not have pre-existing health conditions, where they are ready for their vaccine. So that could easily be June, July, August of next year. And I think we should plan and prepare for that. If I'm being honest with everybody, that is a possibility that June, July, August, September is when community level vaccines become widely available. Let's hope it doesn't get to that, but I think we've got to go in with that possibility in our minds.
Okay, terrific. Thank you for clarifying that. June is still technically the spring, so there's that.
Fair enough. I mean, we hope it is sooner. And if it is sooner, we're going to do everything on our end to make sure that there is an expeditious way to have high throughput vaccination. But the clamp right now is on the production. And until we have a sense of what the longer term production ramp is, it really is very difficult to speculate. I think the cautious part of me is preparing myself and my team for the possibility that it may not be until Q3 that there is widespread availability of the vaccine. I'm going to turn now to Don Kerrigan.
Yes, good afternoon, Dr. Shah. Thank you very much. I have a testing question and then another question regarding long-term care. So the testing question first is we have the Abbott, am I pronouncing it right? Bilax Now rapid tests that are being used in some schools for testing. What is your, should we expect greater use of that, more access of that in the weeks and months ahead? And what's your assessment of that?
Yeah, sure thing, Don. You know, early on, when the U.S. government first started rolling those out to states, one of the concepts of operation underlying that use was for rapid testing of kids in schools. And these Binax Now tests have shown that they can return a rapid result in settings like schools. And we've rolled them out to schools. We can get you the exact number. I don't have it at my fingertips of the number of schools that have applied for them and have received them. We can get you those exact numbers, Don. And from what I've heard from school nurses who are on the front line of the front line, you know, I talked a little bit on Friday and last week about why schools have been safe places. A large part of that goes to school nurses for making the rounds, keeping schools safe. And what we've heard from school nurses is that these Binax Now tests, when students, indeed even staff or faculty, have started experiencing symptoms in the school, that test is a quick way for them to get a sense of what's going on. The student may still need to go home because we don't want anyone who's got symptoms in any school, but it helps allow the school and the school nurse to know really quickly what's going on and thus help inform the parent of what the immediate next steps would be. We have, of course, in Maine, expanded the use of these tests beyond schools to, say, hospital settings and other congregate care settings for the same reason, so that administrators can get a quick sense of what's happening rather than having to wait 24 hours for the other type of test, the PCR test, to come back.
All right. Then the question regarding long-term care, I guess it's a couple pieces to it. One of our reporters heard from a long-term care facility in Kittery that they were supposed to start to be getting vaccinations beginning today from one of those two chain pharmacies, and that pharmacy told them it couldn't do it because it doesn't have the vaccine. You mentioned Friday, with the reduction in the amount of vaccine coming this week, that the start of vaccinating assisted living was going to be delayed. And is that what this is probably about? Or are there still shortages? And I guess as part of that, were you reassured over the weekend that this reduction Maine is seeing this week in the Pfizer vaccine is just a one-time temporary problem?
Okay, great. Thanks for that question, Don. I'll be precise and specific. What is initiated this week in long-term care facilities across Maine is the partnership to vaccinate skilled nursing. The piece that, because Maine did not receive what we were told we would receive of the Pfizer vaccine, the piece that has had to be put on hold is the assisted living piece. The skilled nursing piece, we firmly devoted vaccine for that, and that is the piece that is launching this week. We heard a similar report from at least one long-term care facility that was told by their partnership pharmacy that there were supply issues. Again, when we investigated that, if we are talking about the same place, when we investigated that and brought it to the attention of the pharmacies and Operation Warp Speed, it turned out to be less than met the eye. And again, we are working to get that institution, that skilled nursing facility back on the schedule. But that is not related to, based on what we understand, not related to the lack of vaccine that Maine was promised and would have been needed to activate the assisted living piece. This is a separate part, and I think is experiencing its own rollout challenges.
So if I could just to follow up, so, and then you had your phone, I think you were going to have a phone meeting Friday night and other discussions over the weekend. We've heard from the general leading Warp Speed saying that they've had problems. Were you reassured over the weekend that this problem is being taken care of?
I think the answer, Don, is yes. I'm still disappointed, make no mistake, because we were hoping to get as much Pfizer vaccine as we could, all states were. But at the same time, I respect and appreciated General Perna's acknowledgement that there had been a miscommunication, as he framed it. And I also respect anybody who is willing to give straight answers and recognize that the buck stops with them. And any individual, any leader who is willing to say, this is on me because the buck stops with me, that's someone I give respect to. At the same time, I'm still disappointed, and we had hoped for those higher allocations so that we could activate this other part of the program. So I have mixed feelings about it. I will turn now to Evan at the Maine Beacon.
Hi, Dr. Shah, thank you. So I'm wondering, with both the Moderna and the Pfizer vaccines now authorized, I'm wondering if both of those vaccines are going to be available in more rural, harder to reach parts of the state, or if it's more likely to be the Moderna vaccine because it doesn't require as much ultra cold storage.
It's probably, Evan, going to be largely the Moderna vaccine, but not exclusively so. Let me first start with the numbers. This week alone, Maine is slated to receive 24,200 initial doses of the Moderna vaccine. And we are pushing that vaccine predominantly to hospitals across Maine, with smaller allocations to home health providers and an initial allocation to EMS clinicians. The hospitals that will be receiving the Moderna vaccine this week are predominantly smaller, more rural hospitals, for the obvious reasons that you noted. But it's also important to bear in mind that the Pfizer vaccine can survive for several days outside of that ultra cold environment. And so if there is a need for rapid vaccination, even in a rural area, it's possible, though logistically more challenging. The Moderna vaccine, of course, only needs regular storage and can actually be in a good old regular refrigerator for up to 30 days. So that really maximizes the flexibility. And I think that makes it a vital asset for rural areas. But I don't want to count the Pfizer vaccine out because it will still play a role.
Great, thank you. And just to ask one other question, it seems like congressional leaders have reached a COVID relief deal. Looks like it may be voted on today. And I'm just wondering, going back to what we were discussing last week about how additional federal funding is needed to ensure equity and velocity for vaccine distribution, I'm wondering if you have a sense yet of whether the money for vaccine distribution in that relief package makes you more optimistic about vaccine distribution in Maine, or whether you think more money is still needed.
Yep. So let me start by noting, Evan, that the bill itself hasn't been published. We've been eagerly awaiting it to see the text of it. Haven't seen the text yet, and thus can't comment on it. The devil is always in the details. And so until I'm able to go through it with a very fine-tooth comb, I just can't comment on what it means for the nation, and particularly what it means for Maine, and whether additional resources may be needed on top of that. We're hoping that the bill gets published so we can all take a look at it. But as of 59 minutes ago, when I checked, it hadn't been published. One final note to go back to Moderna, though. You mentioned our two guiding principles, velocity and equity. And the Moderna vaccine, given its easier handling requirements, it really, I mean, it's an equity. I want to draw a straight line between those ease of handling and equity, because that means that those rural hospitals, as well as other disadvantaged parts of the state that don't have ready access to ultra cold storage, can now have the vaccine, offer the vaccine, and utilize the vaccine. That is a direct equity win. So I just wanted to connect those dots and draw a straight line between them.
Thank you.
I'm going to turn finally to Mel Meyer from WGME to round us out for the afternoon.
Yes, good afternoon, Dr. Shah. Thank you so much. I don't know if I missed it at the beginning, but could you talk a little bit about last week? We were talking about the delay that would impact assisted living homes, things of long-term care facilities. Do you have any update from Operation Warp Speed on when we will get those Pfizer vaccines that could then trigger that partnership?
Sure, Mel. And let me first start by noting that the delay is one that I know I talked about this last week, but it was unfortunately a direct consequence of Maine not receiving the vaccine that we were initially projected or estimated to receive. There was no mathematical way for us, given the allocation that is coming into the state this week, there was no mathematical way, given the requirements of the vaccine partnership, for us to proceed with assisted living. We will learn tomorrow what our projected allocations will be for the next week, for week 3. And based on that, we will determine whether the math works out such that we have the ability to allocate a sufficient amount of the Pfizer vaccine so that we can activate Part B, this assisted living component. We'll know tomorrow what our projected, or I think even by Tuesday, they're supposed to be locked projections of what we will receive in the subsequent week. Once we get those, we will do the math, and if it is feasible for us, then we will proceed with activating Part B. That again would mean that residents and staff members of assisted living facilities, intermediate care facilities, all other type of long-term care facilities could start lining up to receive their vaccinations under this retail pharmacy partnership, CVS, Walgreens, and US CDC. But on our end, we've got to make sure that the numbers of vaccine that we are getting allow us to do so. And that is a direct function of what Operation Warp Speed allocates to Maine. Once we know what we're going to be getting, we'll be able to do the math.
I think that does it for me. Thank you, Dr. Shah.
Thanks, Mel. Well, I'd like to take a moment to thank everybody for taking some time out of their afternoon to tune in and hear the latest of where we are. These are exciting times, even though they are simultaneously sad and dark times. Indeed, one of the darkest days that we may have this year, both from a COVID perspective as well as from a daylight perspective. The number of new cases continues to rise, and even though it seems to have taken a pause, there is still the direct possibility that there will be increased numbers of cases throughout the balance of the year. Sadly, new cases bring the potential of increased hospitalizations, as well as the possibility of increased numbers of deaths. But we can also, while we are concerned and saddened by those possibilities, hold out hope simultaneously for the promise that the vaccine holds. And it's not inconsistent to be sad by the depressing numbers and simultaneously to be hopeful that things will get better. The human brain can be both sad as well as hopeful. We can think poor thoughts as well as good thoughts, and we can simultaneously chart a path forward with where we stand with respect to vaccines. The addition of the Moderna vaccines arriving in the state of Maine this week, and hopefully for subsequent weeks, coming on top of the arrival of the Pfizer vaccine, means that as vaccination efforts roll out, more and more people can be afforded the protection of these vaccines and ultimately help all of us get back to that path on the return to normal. I pledge to keep everybody updated in a clear and transparent manner as these changes happen. In the meantime, I thank everybody for taking some time to stay up to speed and up to date on where we stand. I look forward to chatting with everybody on Wednesday. We will not be having a briefing this Friday owing to the winter holidays, but we will be meeting again on Wednesday, and I look forward to providing everyone an update on where we stand then. In the meantime, as always, please be kind, take care of one another. We'll talk again soon.